All right, it's my pleasure now to invite to the podium Dr. Tania Bruno. Now, you're going to see in a few minutes that Dr. Bruno may choose to sit periodically or may choose to stand. And I'm giving her that choice, and we have it all set up accordingly because you'll see that Dr. Bruno is soon expecting a baby. So we're very excited to have her here today and taking that time away. Dr. Bruno is a specialist physician in physical medicine and rehab and a clinician, teacher, and lecturer in the Department of Medicine at the University of Toronto. She completed her undergraduate medical training at Queen's University and postgraduate training at Dalhousie University, where she went on to then complete a clinical neuromuscular and electromyography fellowship at McGill University. She's the staff physiatrist at the Montreal Neurological Institute MS Clinic, and since 2010 dedicated to optimizing symptoms and maximizing functional independence in persons with MS at the Toronto Rehab Institute. Interests extend to research collaboration in the field of MS and exercise, as well as MS rehabilitation advocacy. So Dr. Bruno, we thank you for being here today and taking time.
Thank you. I'm really delighted to be here, and I do not have to rush out, so I'm hoping that if anybody has questions, either during or after the lecture, to certainly come and nab me and ask them of me. So the talk today is the role of exercise in MS, and it's really a patient's guide to wellness, and I will go through some disclosures, and I'll disclose no conflict of interest, but I will disclose right up front a bias. And that bias is that exercise is one of the single most important things that you can do for yourself on a daily basis, and that it makes a dramatic difference in both how you will feel on a day-to-day basis, but also, and this is where we need ongoing good research, but also in terms of disease progression. So we'll go through some of the objectives of this talk and definitions. We'll go through the national guidelines for exercise, which you can all take home with you today through that Get Fit toolkit. We'll go through the benefits of exercise for the general population, for persons with MS in particular, and then we'll deal a little bit in terms of exercise prescriptions and principles. Because the more you know about that, the more you can help guide what you want in terms of going to therapy and pursuing your own therapy on your own at home. We'll talk a little bit about how it impacts mobility and spasticity in particular, and then I'll leave you with some take-home points. So by the end of this hour or so, all of you should be aware of the benefits of exercise. You should be able to list the main types of exercise relevant to you, and the key principles of exercise that will help you maximize the benefits. And of course, you're all going to have the national guidelines for exercise in MS for adults 18 to 64 memorized, right? There'll be a little pop quiz at the end. No, I'm just joking. Certainly, the guidelines were designed for those with mild to moderate disability, but we can definitely extrapolate that to persons with higher level needs. So these are my disclosures, and I was an expert reviewer for the Canadian Physical Activities Guideline, and I did act on the expert panel for that toolkit. So you may see one or two quotes of mine in that pamphlet. I've also received honoraria, I have to disclose that, and I've been on some national advisory boards. Okay, so let's go through some very basic definitions. There is a technical difference between physical activity and exercise. In the end, they try to accomplish the same things. But physical activity is absolutely any bodily movement that is made by muscle that results in burning calories, so energy expenditure. So going grocery shopping and playing with your kids and going for a stroll or wheeling around, those are things that are physical activities. Exercise is a subset of that, and it's planned, it's structured, it's repetitive, and it has as a goal, whether that's a final goal or an intermediate goal, of improving and maintaining your physical fitness. And I will argue that both increasing your physical activity and having some structured exercise in your life will maximize your well-being. So both are really important. And exercise can become a little tedious at times, so you can try to brainstorm on how to jazz that up, how to make it fun, how to add variety so that you want to do it. An exercise buddy is sometimes the best thing to add into the regimen. So if we go through fitness in particular, what do we mean by that? Well, there are a set of attributes that are either health or skill related. So when we talk about health-related attributes, we're talking about your body composition. Body composition is the percentage of lean muscle mass versus water content versus fat that a person has in their system. And as we age, we're all destined to change our body composition. And if we have like events like mine, my body composition has changed dramatically. I'm a lot more fluid than I used to be. I'm a lot more fat too, but so body composition is a very important thing that we need to kind of keep track at and work on. You need a little bit of padding, especially to weather trauma. So, we all occasionally fall. I've fallen 3 times this winter. So we all occasionally have mishaps. So you need a little bit of coverage on top of your bones and on top of, your other soft tissues and hard tissues. But we want to maximize how much muscle mass we have, because that muscle mass can be translated into doing things that you want to do. We also need cardiovascular fitness, so that's the efficiency of our heart pumping through our body and getting the blood flow to our brain and to our spinal cord and to the peripheral nerves in our arms and our legs. That blood flow is essential for bringing oxygen and nutrients to those parts. And I think that's a key integral component of how exercise works. Exercise is a very complex matter and does a lot of things physiologically, but if we break it down to its simplest parts, getting your brain and your spinal cord well fed is key in making sure you're functioning, that part is functioning to the best of its ability. So you also need flexibility. It becomes very difficult if you start to stiffen up your shoulder joints trying to get that winter jacket on, or having your care worker put that winter jacket on you. You need the range of motion, so you need to move the joints in space so that the outer coating of the joint capsule doesn't stiffen up, so that the ligaments which attach bone to bone don't stiffen up, and so that the tendinous part of the muscle stays supple. And then, of course, you want to work on endurance. So you want to work on the muscle's ability to actually perform the activity for a sustained period of time. And you can build on that. We all have the capacity to improve our health-related fitness parameters. We all have the capacity. Now, I have to say that once muscle gets weak to a certain threshold, the changes become maybe less perceptible, but the changes are still there. And then when we talk about skill-related attributes, we talk about things like balance, we talk about agility, coordination, speed. We also talk about something called power. A lot of clinicians will interchange strength and power, and they'll use it as synonymous terms. They're not synonymous. Power is work over time. So it's how much you're actually doing in a very specific time frame. And power, I would argue, out of everything that we're talking skill-related, is the most important. Because power activities allow you to do functional tasks with more ease. And those functional tasks would be climbing a stair, reaching overhead and putting a load away in the cupboard, getting up from a chair. Those are power tasks. And power is something that declines naturally with age. But we know that even in people who are of a very advanced age, and Joe Frontera has done excellent research in persons in their 80s, in their 90s, and almost close to 100, and even in those persons, they can improve their power. And they improve it by increasing their physical activity and by exercise. So there are national guidelines for exercise for the general population. And for the general population, so this would be someone who is between ages 18 and 64 and has no major chronic illness, the national guidelines would say 150 minutes of moderate to vigorous intensity aerobic activity each week. And that can be carved out in little sections of 10 minutes or more. And then, of course, adding on muscle and bone strength training 2 times per week at a minimum. And of course, there's a dose response curve. So it means, you do a little, you get a little effect. You do more, you get more of an effect. You do a lot, and then you really notice the benefits. And it's really only until you get into the very extremes of training would you be worried about any significant consequences of training. These guidelines, which if you divide 150 into blocks of 30 minutes, would come out to less than half an hour, half an hour, 5 days a week. So not even every day a week. And they were deliberately done that way. They were kind of kept at a threshold that the general public would deem doable in our current sedentary lifestyle. But if you actually really go deep into the research, what we're really meant to do is a heck of a lot more than that. A heck of a lot more than that. There was some thought in the American guidelines, these are Canadian, but there was some thought in the American guidelines to step it up to about an hour a day. And people thought, no, that will scare people away. That will totally scare people away from wanting to do it. The take-home point from this is to say that even a little bit is better than nothing. And even 5 minutes a day, if you do that every day, adds up to 35 minutes a week. So you can build on that. And sometimes when I'm devising prescriptions for my patients who've often haven't exercised or moved significantly for years and years, we start with 2 or 3 minutes at the get-go. Knowing that when they're feeling that they have mastered 2 to 3 minutes of that particular exercise, we can go on to maybe 4 or 5. And then we can go on to 6 or 7. And it quickly builds. And you don't have to worry about building it too fast. The time passes anyway. So you could have 8 weeks pass and not do any activity. Or you could have 8 weeks pass, but slowly, incrementally increase what you do. And by the end of those 8 weeks, you will notice change. It does take the body about 8 to 12 weeks to really understand and recognize the differences with the training. So don't think that you'll notice necessarily in the first week or the first 2 weeks of starting a program. But 2 months or 3 months after, you will. So we don't have to go into this in too much detail, but from a physiological perspective, exercise improves the way we handle oxygen, improves the way we storage energy, improves the way our body systems work efficiently, and that's across systems. So that's in the cardiovascular system, so the heart and the blood vessels. It's in the pulmonary system, so the lungs, the airways, and the muscles, and the list goes on and on and on. So we know that one of the things that it does is it augments blood supply. And herein, again, I'm going to repeat myself over and over again because it's something that I want you to really grasp the concept of. Blood flow equals nutrients. Blood flow equals oxygen, and blood flow equals carrying glucose, the main chemical or the main ingredient that fuels our nervous system, the brain, the spinal cord, and the peripheral nerves. And so the more healthy blood flow that you get, the better you are at keeping those neurons firing, keeping those neurons alive. And when I say neurons, I mean nerve cells. So also, you're going to be improving your balance. You're going to be improving your strength and endurance. And you're going to delay things like bone density loss, which leads eventually to osteoporosis. You're going to delay getting something like diabetes or glucose mishandling or prediabetes. You're going to keep your body composition the best that it can be for your decade of age. You're going to improve your mood. You're going to delay the onset of memory impairment and other cognitive impairments. And in fact, I encourage all my patients to do activities that they enjoy to do that stimulate their mind. A lot of my patients like to be participating on internet programs such as Lumosity. Some of them like to do a lot of puzzles. They like to read, like to do other things. I fully encourage that. Unfortunately, the research is not robust to suggest that it actually does much. But we know that we're accumulating a very substantial body of research that says exercise does that. So by exercising, you are at least complementing what you're trying to do by being on these things like Lumosity. So if you want to improve your memory, you want to improve your concentration, you want to improve your attention, you want to exercise. And the best form of exercise for that is the kind of exercise that increases blood flow to your brain and to your spinal cord. Bringing oxygen, bringing nutrients, and that is aerobic type exercise. Now, a lot of people think aerobics, they think Jane Fonda, they think workouts, they think jumping jacks, they think things like that. No. There are a lot of ways to get your heart rate up. Even just bringing your arm up above your shoulder level, above your heart level. You do that enough times, you're going to get your heart rate up. I'm going to show a picture of my absolute favorite exercise machine in a little while, where you pedal. That gets your heart rate up. If you're able to walk, walking gets your heart rate up. So there are very simple and inexpensive things to do that you can do on your own without fancy equipments and even without fancy gyms that can get your heart rate up in bouts of 10 minutes or more. We know that it improves life expectancy. We know that it reduces fatigue. And we know that it decreases social isolation, because people who feel better and people who are doing more are able to get out more, want to get out more, and usually are doing things in common with other people. You know, exercise or physical activity issues can be very social things. Now, we know that there is another population that has been really well studied for exercise. Actually, there are a couple. The stroke population has been very well studied. The fibromyalgia population has been very well studied. Spinal cord injury has also been very well studied. And the reason I'm including it in this lecture is that there is a lot of overlap between spinal cord injury and MS. The vast majority of my patients who have had MS for years to decades have lesions in their spinal cord. So they have areas of demyelination, or they have plaques in the spinal cord that interferes with the signaling from the brain downwards to the spinal cord, and the spinal cord is essential in getting that message out to the rest of the body. Okay, that's where the nerves come out of. They come out of the spinal cord. So in having lesions in the spinal cord, it's almost, in a way, like having a spinal cord injury from trauma. So the two populations overlap a little bit. Not 100%, obviously, but there is some overlap. And we know through the studies in spinal cord injury that the benefits of regular exercise include increasing endurance and making self-transfers easier. We know that it enhances self-care, so promoting functional independence. It improves mobility, social interactions, and overall health-related quality of life. So that's a person's personal, very subjective assessment of how well they're doing and how well they feel at their current stage of illness. We know it reduces pain in persons with spinal cord injury. And what kind of pain do persons with spinal cord injury have? They have every kind of pain. They have primary nerve pain from unusual signals in those areas that have been traumatized. They have pain from being sedentary in a wheelchair. They have pain from secondary muscle, joint, ligament issues. So the burden of pain in spinal cord injury is quite high, and I would argue it's similar to many persons with MS. And we know that it helps with that. We know it helps improve stress. And you've probably heard your practitioners all talk about stress reduction and how important that is in MS. Keeping your stress level low has a wide-ranging effects on hormones like cortisol, has a wide-ranging effect on how your immune system behaves. We need to keep stress the lowest possible, and we know that exercise helps do that. Reduces cholesterol and other lipids. So lipids are fats. There are good fats, there are bad fats, but keeps your fat profile optimized. improves the way the body deals with sugars, okay, so decreases the risk of getting something like diabetes, and improves sleep quality and energy. So again, exercise is helping the whole person, and one helps something else. So for example, one of the things that I say to my patients all the time is, you want to preserve, at the very least, what you already have. And how do you do that? Well, you try to manage every body system to the best of your ability. That is to say, you don't want to accumulate additional problems. And persons with MS, just like any other member of the population, is going to be at risk for all the other stuff that the population is at risk for. And in our culture and our society, we're kind of all at risk for maybe putting on a little bit too much weight. We're all at risk for getting heart disease. We're all at risk, plus or minus. Obviously, genetics does come into that as well. There's always a genetic environmental relationship. But you want to decrease as much as possible getting any additional problem for two reasons. Additional problems can often impact the blood flow, the oxygenation, the appropriate nutrients getting to the brain and the spinal cord, making already vulnerable nerve cells even more vulnerable to loss. And, this is the second important and, anything that is a stressor to your body has the potential to unmask the true burden of your lesions, okay? So, I know a lot of you may have heard of the term pseudo-relapse. What is a pseudo-relapse? Pseudo-relapse is an event where suddenly you're going along totally fine, and then you get a flu, or you get the common cold, or you get a urinary tract infection. And then suddenly, oh my gosh, things that you could do just a week before, you can't do. Sometimes it's very dramatic, and you can go from transferring no problem to not transferring at all. And that's because normally your body has enough energy on board to kind of bypass some of those areas that don't work so well and compensate. But when you don't have enough of that energy because it's being redirected into fighting an infection or redirected into healing a broken bone or a sprained ankle, then you don't. So you don't want to catch or get anything else. The MS is enough. So if you can delay the onset of age-related diseases, if you can delay the onset of age-related changes, then you go a long way to preserving your function for as long as possible. So in terms of exercise and MS, these guidelines were published relatively recently. They came out in November of 2012. And they were developed with, I can tell you this because I have inside knowledge on this, a very, very rigorous, systematic method. And there were tons of journals, articles that were read, tons of studies that were reviewed. And the reason why the guidelines show up the way they do has to do with the body of evidence that is currently or was currently in the literature at that time. Most of the studies have recruited persons with an EDSS of 3 to 7. I'm going to show a scale, the Expanded Disability Status Scale, in a few more slides and show you what that means. But it's a way for neurologists and other MS specialists to kind of quantify the disability. It's very much weighted to mobility, such that a 6.5 means that a person needs bilateral support. And by 7, they need wheeled mobility, okay? So it's looking at a very kind of narrow slice, but it's looking at a narrow slice because those are the persons that have had the most ease of actually participating in these trials. So it had to do with looking at who was included, who was excluded, what was actually studied. And so they looked at all the studies. They found the ones that were done, with the most scientific rigor, a lot of them that were randomized and controlled, and then they took all that information, they analyzed it, and they spat out what they could from it. And that's how they developed these guidelines. And so the dose is actually lower than in the general population. Remember, the general population was 150 minutes a week. but it's actually up from spinal cord injury. And where it differs from spinal cord injury is that the intensity is reduced. Okay? So when you're exercising for those 30 minutes twice a week as your minimum target goal, you are supposed to be working in your rate of perceived exertion of 5 or 6 on a scale of 10. What does that mean? I'll translate it into English language. I would say if 10 is complete torture from exercise, and you can't breathe, it hurts, you want to stop it at all costs, and 0 is asleep, you want to be halfway. So you want to be able to talk, but not sing. And we know from not just research on persons with MS, but research on multiple different populations, including the general population, including the population of heart attack sufferers, that people are really good at knowing how hard they're working. And people really can judge it even without checking their heart rate. So you really don't even need to check your heart rate unless you actually have a cardiac condition. Okay? But you want to feel that, your heart is beating a little bit more than it would normally. This is my favorite machine. This is an arm cycle ergometer. This is something that persons who can easily use forelimbs can use and do well with. And this is something that a person who doesn't necessarily have great use of the lower limbs can still use and get fantastic, fantastic results from. I have one patient, and I know he wouldn't mind me sharing this information with you, that took my advice that he needed to really boost his exercise and he really needed to lose weight. I talk a lot about weight in my clinic. It's a difficult thing to lose, but he religiously used this machine. He started low and he ramped up. And he became a user of this kind of a machine, not particularly this one that's actually on the screen, this make, but something very similar to it, where he cycled and he could change the resistance on the arm cycle. And he lost 60 pounds. And he's non-ambulatory. Doesn't walk. This gentleman does not walk. He lost 60 pounds. And he felt great. And he looked great. And, keeping him sharp. So where there's motivation, there's a way to adapt the exercise for you. There's a lot of ways to take what you have and to apply it and make a personalized regimen for you. Okay? This is one method of how it can be accomplished, but there are other methods. It just takes a little bit of creativity. So, recapping, and this is one of the take-home points, you want at least 30 minutes of moderate intensity aerobic activity 2 times per week. These are minimums, and they do not need to be clustered together. It doesn't mean that, you have to do your aerobic exercise on Tuesdays and Thursdays. It doesn't. You can spread it out. And I would hazard that if you can try to spread it out evenly throughout the week, so much the better. When it comes to aerobic type exercise, you do not necessarily need a day of rest. When it comes to weight training, of course you do need rest, but for aerobics, you don't. We're meant to move. We're meant to move all the time, every day, and for very extended periods of time. And the body recognizes and changes when we're not moving. But on the positive side, on the flip side, the body recognizes when we're doing even a little bit of something. And even a little bit of something has a very large impact. And that is why the guidelines are written the way they are. We know that lower amounts of exercise in the MS population can often have much more of an effect than we would imagine if we were dealing with a population that didn't have MS. Okay? Not just the aerobics, you need to focus on strength training, and so that would be a minimum of 2 times per week for all the major muscle groups, and we're dealing with repetitions of about 8 to 10. Okay, so if you were going to do arm curls, you would want to do sets of 8 to 10, 2 or 3 times. You want to do leg extensions, 8 to 10, 2 or 3 times. And ideally, the goal would be to do this every other day. Okay? So what do we know from the literature? We know that meeting these guidelines improves the fitness parameters of persons with MS. And we know that patients with MS positively respond to exercise, which is really, really important. By knowing that persons with MS respond to exercise, in my way of thinking, you have access to all of the benefits that exercise does for the general population. You do. I mean, I'm going to state that. We can't put that in a national guideline. We can't put that on paper because we don't have the literature to support it. But really, persons with MS respond, and many of you mirror the general population quite well. We know that in addition to responding physiologically to exercise, that it quite possibly reduces your fatigue, improves your mobility, and enhances elements of health-related quality of life. So generally speaking, you feel better, you're less tired, you're moving more, and you want to do more, and it's a positive cycle. The reduction in fatigue is a very important point because many of you suffer from what's called neurogenic fatigue. And it's not your regular tiredness, sleepiness. It has to do with the fact that your neural circuits, your neural pathways, the way the nerve cells talk to one another, is always working at a bit of a disadvantage because you have these areas that have demyelination, or the coating on the nerve cell has been challenged. Sometimes it's actually been removed completely or it's been repaired. But if it's been repaired, it hasn't been quite repaired to the extent of its original self. It never gets to 100%. So even in areas of the brain where you've had a relapse and then you've recovered, that area is not 100% the same as before the relapse. So you're always working a bit harder to get the job done. And that takes a toll. You're working harder not just physically, but you're also working harder mentally. So things like multitasking or concentrating or coordinating things or trying to remember something. You're always working harder, and that takes a toll. So that kind of fatigue lessens with regular exercise and increased physical activity. What you will notice go up, especially the day of the exercise, is fatigue from the exercise. But that's okay. That's normal. Everybody who exercises gets a little tired after their exercise. So the critical thing is in not getting over-exhausted. You don't want to push to the point where suddenly you can't do what you need to do. And the second most important thing is you don't want to push so hard that the following day you're tired. Because if you didn't have MS and you worked really, really hard on some kind of exercise routine, you'd be tired that day. You might even be completely exhausted. You might have to just go to sleep, but you wake up fine the next day. Maybe a little sore, but you wouldn't be tired the next day. So if you're tired the next day, you did too much. So you have to scale back. You have to pace yourself, and you have to conserve your energy. So the two caveats to exercise would be don't overheat yourself, because your neurons have to work under very specific parameters. Your brain cells don't like heat. They don't function as well. So keep cool and listen to your body. So for that range of exertion, you want to stay very much in it. You don't want to push too hard. Or if you push too hard, you push it at your own risk. You will eventually recover from it. It's not going to permanently damage you. Okay, unless you have some mishap as a result of your fatigue, like a fall that injures yourself. But really, you can play around with how hard you're working, and then you can find the happy balance that you need to feel better. So again, we don't have to go through this in great detail, but there is, really strong evidence that in persons with MS, your muscle strength improves, your cardiovascular fitness improves, your ability to do power activities, so work over time improves, endurance for walking, speed of walking, fatigue, quality of life. There's really good evidence for that. And Latimer and Guinness, they are the main investigators who put together these guidelines. Now, there are a couple of things that these randomized controlled trials could not capture. And herein lies sort of the state of our understanding of this at this time. These level 1, highest, level evidence, scientific evidence papers could not really capture benefits on spasticity, on neuropathic pain, on sleep, on depression, on cognition, on bowel bladder control, osteoporosis management, and reduction in comorbidities. That is not to say that all of these things don't happen. It's just to say that with the designs of the studies as they have been currently, we have not been able to capture it. And sometimes that relates in and of itself to how the research study was designed and also the numbers of participants in that study. Because when you're dealing with a scientific assessment of cause and effect or even correlation relationship, you have to apply statistical methods to the evidence. And for statistical methods to work, you have to have adequate numbers. And sometimes these studies have been what we would call underpowered, or they don't have the numbers to support it, okay? But from a case-by-case basis in my practice, and now I've been working many, many years, almost exclusively with patients with multiple sclerosis at 2 centers. I was at the MS clinic at the Montreal Neurological, and now I'm at Toronto Rehab. I can tell you that in my experience, exercise helps everything on this list. Absolutely everything on this list. And I have no doubt that over the ensuing years, we will gather more and more data that hard and fast proves that point. And I want to tell you that there's ongoing research all the time. Like there was somebody who was supposed to be here earlier to try to encourage you to sign up for another study that would look specifically at cognition and mood. And I encourage you to look that over, and if you can participate, so much the better. So we're gathering data all the time. And multi-centers too. So it's not just people in Canada that are working on this, there are people working on this internationally. And I want to put it out there for you that you can cautiously extrapolate from what we know from other populations. So just like we know from the spinal cord injury population that it might improve, the ratio of the healthy fats to the bad fats, well, you probably can bet that it does that for persons with MS too, and so on and so forth. Take-home point. This is very, very important to note. Exercise in MS does not promote disease progression. Actually, probably the opposite. Does not promote relapses if you have relapsing remitting disease. And it will not, if done properly, worsen fatigue. Even up to 15 years ago, people were often told don't exercise. And that's unfortunate. And in fact, I had one patient come to me a little while ago and said, I wish someone would have told me that when I got my scooter and was relying on it so much, that I wouldn't then be able to walk anymore or transfer. And I said, you're right, that's too bad, because use it or lose it. You have to keep up your level of function to try as hard as to maintain where you are. And that requires movement. And movement comes in the form of physical activity. So all your basic activities of daily living, getting up in the morning, dressing, grooming, doing your bathing routine, going out and about, and the structured, repetitive, scheduled exercise. And I already went through the caveats, but a lot of you may or may not know that there are cooling equipments that you can purchase. So these are some examples of cooling vests, but there are also things like cooling cuffs and cooling collars. There are spray bottles with mist. You should always be exercising in a cool environment if that requires the window open or a fan or an air conditioner to be turned on. And also staying very well hydrated and making sure that the liquid that you're drinking, which hopefully would be water, is quite cool. And obviously, some of you don't like to drink too much because it makes you rush to the bathroom. So, you have to kind of weigh the pros and the cons. So maybe you exercise at home, close to your bathroom. Maybe you exercise close to your commode. I don't know. You find a way around it. You want to be well hydrated and you want to keep cool. This is that sort of cartoon graphic of the expanded disability status scale. And at 6, you need a bit of assistance to walk. That's pretty much a benchmark. Most of the patients that come to see me are at about 5 and above. Some people come less than 5, especially if they want to really try very hard to stay below 5, but most of the people that see me are 5 and up. So I'm intimately aware of the troubles that come with having an EDS of 5 and above, and everything that I'm talking about really is very applicable up to being confined to bed. And the whole point of doing this is so that you don't get confined to bed. Okay? Now, there is an exercise physiologist in the US who is world-renowned. His name is Mottel. He is a champion of research in exercise for MS, and he goes way, way, way back. And he wrote a wonderful paper on it a little while ago in which he proclaims that the physiological deconditioning, and what deconditioning means is lack of fitness, is actually thought to play a role in the process of progression. So if that's the case, if being unfit contributes to disease progression, you can kind of work backwards and say, don't get unfit. Now, obviously, everybody's an individual. Nobody has a crystal ball for any one particular person. But generally speaking, maximizing what you do for yourself and capitalizing on your own personal strengths will allow you to have the best disease course that you can, especially once you transition from relapsing remitting to secondary progressive, or if you happen to be in the primary progressive phase from the beginning, where there are no disease-modifying therapies yet available. So what does that mean? So you want to exercise to stall progression. You want to exercise to maintain or improve your abilities. You want to exercise to prevent falls and complications of immobility. And you want to exercise to feel great and to exert some control over your disease. And I think this is a fabulous way to exert control over your disease because it can be free and it can be fun and it can involve your loved ones. And we know that the benefits are there. I want to tell you a little bit about not using your body. A muscle has to function at least 50% of its maximum strength to maintain its normal strength and to avoid shrinkage. That's a lot. It means you've got to use it on a regular basis, and you have to use it to at least half its current capacity to maintain what you have. Now, if you're using it more than half of its total capacity, then obviously you build and you improve your capacity. The other thing to point out is that the rate of decline in muscle strength from baseline, if you happen to be immobilized for a particular reason, say a fall in which you break a bone and have to have a cast, is 15% per week. So if you're already functioning kind of marginally and you're at a threshold where things are very hard to do and you don't have a lot of reserve, and then you suddenly don't move for a week, you're in trouble. And that's one of the reasons I kind of hound people about preventing falls. Falls can lead to concussions, which are bad for the brain. Falls can lead to worse things than concussion. They can actually lead to frank intracranial bleed. And they can lead to broken bones and sprains and bruises and soft tissue injuries. And they can just cause a lot of damage to your system, such that A, you don't feel like moving, or B, you don't move because you can't. And then suddenly you're left with a problem. So a lot of people come to me and say, I would really like to walk, but they haven't walked for a couple of years because something prevented them from walking, like a fall or like another illness, and suddenly they did not get back up to where they were. And the longer the time period between not doing and trying to do, the less the chances of being successful at regaining your abilities and regaining your strength. So be vigilant. Know that in advance and try to plan. Evolutionarily, we were meant to walk more than 8 hours a day. So you can see that the way we live our lives today, we're very compromised. Many of my days consist of sitting for the vast majority of the day. Yeah, I'm up and about from my office to my secretary's office, and I try to go to the bathroom by going to the bathroom at the end of the hall, and I try to, pump my feet a little bit in the chair, but I'm sitting. And now we're getting research that tells us that sitting is bad, but what can you do? Well, you try the best that you can with what you've got. You have to work with the confines of what you have. So if you have to sit, but you still have use of your arms, use your arms. Your arms can compensate quite a lot for not using your legs. Legs are the largest muscles of the body, so it's the easiest to get calorie expenditure and your heart rate up from moving the larger muscles. But if you don't have the larger muscles to use, you can get a lot out of using small muscles. So whatever you have to use it. And you can build on that. There are a lot of complications from not moving, and they cross every single body system. They include things like collapse of the lungs, so not filling your lungs completely. Collapse of the lungs leads to a very much increased risk of pneumonia. There are problems with getting all the nutrients in the gut, and the gut moves a lot slower. So by just being immobile and not exercising, you run the risk of worsening your constipation. So exercise, and even exercise with your arms, can undo some of that, okay? It can cause changes in how your heart responds. And you might suddenly be finding that your heart rate is up even when you're not doing anything. And that's taxing. That is not efficient. That is wasting your energy on things that really you don't want to be wasting your energy on. It can put you at risk of all sorts of other infections, and it can change the suppleness of the joints and the tendons. So you can become what we call contractured or stiffened, so that the full range of motion that you originally had is actually compromised. So there are a lot of not good things that can happen, and this is only a small list. The list is actually quite a bit longer. So when you're dealing with exercise to try to prevent that, you want your exercise, you want to know the type of exercise, you want to know how often you're supposed to do it, you want to know for how long to do it, and you want to know how hard to do it. And we've talked a lot about that so far. If there's a question, I'll answer.
There is a question right
Sure.
up front here.
It's referring to the previous slide, the first word. What
Sure.
is it? Let's start with an
So atelectasis is the collapse of the lungs. Yeah. Yeah, I didn't use it because I thought maybe most people wouldn't know what it meant, but it is the collapse of the lungs. Manilial infections are yeast infections, and they usually happen in what we call intertriginous areas or folds of the skin. And so if you are stuck in one position all the time, then, there's not a lot of air circulation, there's moisture that builds up, and we're covered with yeast all the time. We're covered with bacteria head to toe, but our movement, our activity, and our immune system tends to keep everything in check. But when you start not to move and you slow down and you get to the point where you're immobilized, then suddenly all of the parts of our body that would have things to grow, they start growing.
Okay, just moving over here.
Sure.
A friend of mine had told me that because I have MS and my immune system's working all the time, that I have less of a risk for catching flus and colds.
I'm afraid that's not true. I have to dispel that. And one of the things that I have asked every single patient this year is, have they got their flu shot? You are not immune to catching infections. In fact, it may actually be the opposite. So what's happening in MS is twofold. There is an immune dysregulation, and then there's probably, to a varying degree from one person to another, depending on their particular disease state and disease course, an underlying neurodegenerative process. So that means there's something happening in each nerve cell that is making it vulnerable to cell death. And then there's the immune system that is acting in a particular way inside the central nervous system, so the brain and the spinal cord, to not help the system. And in fact, some people believe that the immune dysregulation is specifically to try to help the system because of this underlying degeneration, but it doesn't. And what it does instead is it attacks parts of the system and makes it even more vulnerable. So it's not that you've got such a fantastic immune system and it just so happens to be, attacking the myelin. It has to do with how that immune system is regulated. So it absolutely has nothing to do with your susceptibility to flus and colds. Meticulous hand washing, really, really important. I advocate strongly for flu shot every year. And for people who are not 100% mobile, persons who have chest wall weakness, who have a weak cough, who have issues with speech and swallowing, and who are already spending the bulk of their day in power wheelchair, scooter or manual wheelchair, I recommend the Pneumovax. And that's once every 5 years, and that's to reduce the risk of pneumococcal pneumonia.
Hi. My question is, hi, it's Lisa over here.
It was like
Thank
the
you.
voice is coming from there.
Oh, okay. Apologize for that. Since we have all this plentiful literature and research done on how beneficial exercise is with MS, how can you guys figure out, you doctors and researchers, shouldn't be able to figure out a way on how to start growing the neurons back once you exercise?
That's a very good question. And I have to tell you that research exists on different levels. So there is what we call wet bench research. So it's actually looking at cells in petri dishes. And then there are animal models, so looking at total organisms, but obviously not humans. And then there's the human side of things. The reason why it's so difficult and challenging to regrow nerve cells is that the way we were constructed is that our nervous systems are encased in a bony cage. So our brain is encased in the skull, and our spinal cord is encased in the spinal column. And because of that, having apparent growth or uncontrolled growth is counteracted, because if you suddenly had a cell that kind of got wonky and grew more, there'd be no space for it. And so there are lots of inhibitory signals in the brain and in the spinal cord that shut down new growth, unlike in other parts of our body. And so that's what makes it really, really challenging. And so it's about these multitudes of inhibitory factors that need to be taken care of. So people are looking into that. People have been looking into that for a really, really long time with spinal cord injury as well. The Rick Hansen Foundation for a long time was pushing that kind of research, and that kind of research has been going on, will continue to go on, but it's super, super complex, and our state of technology is just not there yet. But we're working on it. We're working on it.
Can I have a quick follow-up question? So what happens when those nerve cells die?
They don't get replaced, but the body mops them up.
So what happens when the nerve cells die? Just repeating it for the video. Thank you.
Yeah, so our body has two ways of having cells die. And one kind of cellular pathway is called apoptosis. It's a very controlled cellular death. And the body mops it up and cleans it up without an inflammatory response that goes a very abnormal inflammatory response. And that's what happens. So our body is very good at mopping up cells that are dead and clearing them out of the system. But unfortunately, in the brain and in the spinal cord, nerve cells do not regrow. What does regrow, to a certain extent, are the oligodendrocytes. Those are the cells that actually produce the myelin. They can regrow. And there are other support cells in the brain, like astrocytes, and there are a couple of other ones that do have the possibility of regrowing. And it is thought that maybe regrowing some of these cells actually can be beneficial for brain functions and spinal cord functions. but we're still at a low level of understanding compared to where we need to be.
I'm curious about I've seen some things about the elasticity of the brain and cognitive exercise. I've never heard any, or I haven't seen anything about that. Do you have any thoughts on that?
So am I correct in thinking that you're talking about neuroplasticity?
I'm not sure. It's where your brain compensates.
Right. So yes. So I think what you're talking about is neuroplasticity, and neuroplasticity reflects the fact that our brains can change how they connect. Our nerve cells in our brain can change how they connect with one another. And they do that with little tiny processes that grow out from the cell body called dendrites. And those dendrites make contact with other nerve cells. And so we are always trimming those dendrites and regrowing them. It's called pruning. And we reinforce the pathways that we constantly use, and we make them more efficient, and we cut down the ones that we don't use. So it's a process that's going on all the time, constantly and 100% of the time. It's thought that exercise provides, especially cardiovascular, the ones that I talked about, that the heart rate is going and you're getting the blood flow to the brain, actually helps reinforce that kind of neuroplasticity. So what you're doing when you're exercising is you're allowing the brain the most potential to do what you're saying, to kind of rewire itself to work with what it's got.
Is there anything specific we can do to work towards reconnecting these nerves?
Absolutely. There is actually some research that suggests that if you do mental exercises, so if you're thinking about what you want to do, either before you're doing it or concurrently with doing it, that gives you a better outcome than if you were just to do the activity on its own. And they've done that kind of research, especially with patients with stroke and traumatic brain injury, but they've also done it with elite athletes with no other problems. So they've taken kind of groups of people where they've said, okay, we want you to practice getting up from a chair, okay? And then they time how quickly they're able to rise from a chair and maybe take a few steps, okay? And they've kind of randomized two groups. The group that just practices that, actually three groups. The group that practices that, the group that thinks about it and practices that, and then the group that thinks about it and they don't actually do it. And the groups that did the best were the ones that thought about it. So the group that just thought about it did better than the group that just did it without thinking about it. So if there's something particular that you want to improve on, focusing your attention on that and augmenting that with exercise is probably the best way to go. There's no magical drug right now that we have on the market to improve specifically how the brain readapts, okay? But there are medications like Vampira, for example, that improve the conduction of the electrical signal across areas that have demyelination. So there are medications out there that can boost how you're functioning, but really we're still at the infancy in how to help compensate for the losses.
Okay, it looks like I'm heading over here now.
Hi. If I get influenza or a stomach virus when everyone else recovers in 2 or 3 days, it can literally be 4 weeks or 6 weeks for me. Is it a fair expectation that being more rigorous about exercise will help diminish that?
So I cannot cite any particular article that says yes or no, but from my clinical experience, my answer is a resounding yes. So the more you work on improving your total body fitness level, the better you will be at having a buffer for some of those decreases in activity and functional level. And also, you will bolster your immune system so that you fight that flu off a little bit easier. The key is not to get the flu in the first part, okay? So I would be very cautious in terms of being around people who are experiencing infectious symptoms. I have suggested to some of my patients to have hand sanitizer at the front door and to ask everybody that comes in to pump a little bit and to actually hand sanitize their hands. I've actually gone so far in some instances to ask some of my patients to have masks at the front of their door and to have people who visit wear masks. I know that's extreme, but clearly it's case by case, but meticulous hand washing is important.
That medication you were just speaking of, the Vampira, is that for, someone had told me about a medication that was prescribed to them to help them walk further distances?
Yes.
That
is the medication. So right now on the Canadian market, it's indicated for improving walking speed. And
Would you give that to a mobile person like myself to be able to actually walk 3 blocks quickly? Or would that be kind of...
Potentially. So when I review a patient for that medication, there are a couple of things that I look at. I look at whether or not they've ever had a seizure in the past. I look at whether they have good functioning heart and whether they've had a cardiac arrhythmia in the past or irregular heart rate. And I look at how healthy their liver and their kidneys are. And then obviously I look at the other medications that they take to make sure that the combination of medications is safe. But certainly there is definitely a role for it to improve mobility, and I prescribe it a lot.
Why is not everyone on this? Like, I've
Well,
never heard of this before.
Why is not everyone on
I can
it?
walk further if I took this.
So right now we know that the response rate in the population to this particular product is somewhere between 45 and 60%. So not everybody will notice a clinical improvement for walking speed. That's not to say I don't actually prescribe it off-label, but I probably shouldn't talk about off-label uses right now. So not everybody will notice enough of a change, okay? But for the people who do notice a change, they like it.
For endurance?
It's for speed. And so the thinking is that it improves the connections between the brain and the spinal cord, and therefore the neurons or the nerve cells that go out from the spinal cord to the individual muscles, and improves how they actually fire, how they actually work. And that's to help bypass some of those lesions, especially in the spinal cord, that kind of interfere with that. So if you're using your muscles more effectively, then you have more energy to do more, to do it better. Maybe it improves spasticity. So,
Hi, I'm Janice, and I can't sit too long, so I'm going to stand. I'm 53 years old. I was told I'd be in a wheelchair by 50. I don't have just MS. I also have Charcot-Marie-Tooth, which is a hereditary peripheral nerve disorder in my lower legs and arms. I have been attending exercise classes at Body Harmonics for the last 6 years. When I started with these classes, if I dropped something, I'd have to lower myself by the couch, crawl over my hands and knees, pick it up, crawl back, pick myself up by the couch, use my walker to take it to the garbage can. Now, oh, Dr. Bruno, you dropped this. The classes gave me the balance, the strength, and the coordination to do this. In support of what Dr. Bruno says about exercise, I just want to say how these classes and these teachers have given me back my life. They're my angels. The program is, the Pilates studio itself pays 2/3 of the costs. As a client, I pay 1/3. The teachers are phenomenal. I go to the group classes. I have one-on-ones as well. A woman who used to give me massages years ago, she ended up going there to become a teacher, and she saw me, and she said, Janice, your posture is so much better than before you had MS. And I said, well, that's the secret to having good posture, get MS. So if anybody wants to talk about these classes, I should have brought some information. I didn't, but I strongly suggest them. And as Dr. Bruno says, they've given me exercises to do at home. So if I know, okay, my hips don't feel right, and that's as far as I can describe it. And I know what exercise to do for that, to even out my hips, for me to walk easier. all because of what they've taught me. So I can do the little bits of exercise. Now, I am no saint. I don't do 30 minutes of exercise 5 times a week. I'm not that disciplined. I'm too busy enjoying my life. But I do the little bits now and then that I've been taught. So just to reinforce everything that Dr. Bruno is saying, and also to push where I go, because I just, thank heavens for my teachers. Body harmonics. I think it's on the MS site. It used to be. It's on. Okay, and they cover 2/3 of it. The Pilates studio. The Pilates studio is called Body Harmonics. It's at DuPont and Christie. They also have an Italian cafe on the 1st floor. We do the exercises on the 4th floor. So gosh darn it, we meet for dinner and coffee after, and socializing. It's just such a rough day.
And I didn't even plant her.
I will give you back your mic, Angela, though, don't worry. Any questions? Come see me after about this program, because I think they're phenomenal. Here's your mic back.
Thank you. Thank you very much. And yes, we do have that information on our website. If you go to mssociety.ca/Toronto, all recreation programs that we're aware of that are MS specific are on there, including Body Harmonics. But I have to head over here now. Oh, it's for me to read on my own.
Should I continue?
Maybe we should have you continue, but did you have a question related to what's just been discussed? Okay, and then we'll continue.
Okay, sure.
I just wanted to ask, I know the flu shot is yes, as you mentioned, but how about the shots for shingles?
Okay.
Because I just asked my friend doctor today, he said, absolutely no.
Yeah, so the jury is out for the Zoster's vaccine. So I am not giving a particular opinion globally for that one. That might be on a case-by-case basis. However, there are many neurologists who just basically say no problem. And for the vast majority of my patients who've asked me, I say no problem. So there may be individual cases that having an immunization may be deleterious, especially if it's that particularly new one. It's only been on the market for a little while, so there may be cautions on a person-by-person basis. So I don't make a blanket statement for the shingles vaccine. And in fact, most people don't have to worry about getting shingles until they're over 60, and in fact, most of them over 70. So that doesn't necessarily apply to the vast majority of my population. But the flu shot, I can tell you, at the Montreal Neurological, we all said yes to the flu shot. So I say yes to the flu shot.
So we're going to let Dr. Bruno just continue. I do see some other hands, and we will get right back, unless it's related to what we just discussed. Okay, one more. If you can just repeat what she commented.
So you are a happy user of Vampira? Very good. Excellent. Wonderful. Very good. So I want to talk a little bit about exercise prescriptions. Clearly, if you have the opportunity for supervision of your exercise, that's ideal. But the guidelines can be applied in the absence of supervision. And the need for physiotherapy or kinesiology guidance could be appropriate for some individuals, depending on cognitive and physical limitations. But again, person by person, and there is much that a person can do on their own. In fact, when we bring people to the rehab, we train them with a home program. And when I fill out forms for community care access physiotherapy, the whole goal is to establish a home program. And there is that expectation that that home program is being done by the person. Now, if they have a personal support worker to help or a family member to help, so much the better. But there's a lot that people can do on their very own. And there are a lot of resources to assist patients. You just heard a nice testimonial, but there are online resources, and the MS societies locally, provincially, nationally are fantastic at providing the resources. So if you are online a lot, have access to the computer either at home or through a library, you can get much material through the internet, or the MS Societies are a phone call away. So I want to talk a little bit about exercise principles, because if you have this kind of information, it'll make your training a little bit more effective, I think. There is the principle of specificity, which says that to become better at a particular exercise or skill, you have to perform that particular exercise or skill. And this is probably, out of all the principles, the one that is most important. So if what you want is improvement in walking, you have to walk. Yes, it's helpful to do other exercises like arm cycling, but there's only a little bit of cross training that you get from that. You really need to do the activity you want to improve, and if you can do that activity while concentrating on that activity, that's so much the better. Then there's the principle of adaptation. The body will adjust to the demands that that are placed on it. So you do have to, over time, ramp up your training because your body will get used to it. So if you want to continue to see benefits, you've got to push yourself a little bit more over time. We already talked a lot about the principle of use-disuse. So use it or lose it, essentially. There's an adaptation to exercise, and there's an adaptation to immobility. And then there's the principle of overload. So in order to adapt to exercise and get a training response, the body has to be taxed with greater than normal stresses. Remember a couple of slides back, I said that in order for the muscle to maintain its function, it has to go through 50% of what it can really do. So if you want to improve it, you got to go well beyond 50%. And sometimes you even have to go to the maximum. There's a principle of progression, which means that you have to have adequate rest between bouts of training. And this is also to avoid injury. And, you don't want to be weekend warriors. You want to start low, to go slow, and be steady about what you do. And then, of course, there's the principle of individual differences. So there's the response to training, person to person, varies because we're all genetically unique. Even identical twins have some slight variance between one gene expression and another. So you have to tailor what you're doing for yourself. And just like the testimonial, there are wonderful group programs that have been adapted for persons with MS. Tai Chi is a particularly good one. Aquafit is fantastic. And there are some, but not as many as we would like, accessible gyms. And I would say probably Variety Village is the one that I cite the most, and that's out in Scarborough. So the guidelines specify minimum frequency and duration, but be mindful of the dose effect. You can keep ramping up, and you can't forget things like balance training, core and pelvic floor strengthening, and flexibility training. They're not specifically addressed by the guidelines, but they're super important too. And I can't highlight how important daily stretching is. And when I say daily stretching, I often mean more than once per day. It's an absolutely integral component of managing spasticity. Many of you will already know what spasticity is because you experience it. For those that don't have trouble with it, it's a stiffness of the muscles and often is accompanied by spasms. And it can impact transition movements, mobility. It can lead to stiffening up of the joints, pain, and it can interrupt sleep significantly. I won't go into this too heavily, but we all have a certain amount of resistance in our muscles to passive stretch. And in a spastic muscle, that resistance is exaggerated, especially the faster you move the muscle through its range of motion, the more there is resistance or stiffness. And that can really impact people when they're doing functional tasks like walking. Every noxious stimulus enhances that reflex to make the muscle more spastic. So some patients benefit from this stiffness and it can compensate for weakness, and some people really fight against it. So whether or not to treat spasticity is an individual decision, but making sure that you keep the range of motion at your joints and you minimize the spasticity for comfort levels is super important. And the way to do that is by sustained stretching. And by sustained stretching, I mean stretching like 60 seconds, 90 seconds, 120 seconds or more. In fact, with kids with cerebral palsy that have extreme degrees of spasticity, sometimes they're stretching their muscle for 2 hours a day. So the more you stretch, the better. So there's a little bit of evidence that in the literature that this helps. There's not as much evidence in the literature as we would like to see, but we know that passive stretching has an impact on all of the elastic properties of the muscle, tendons, ligaments, and joint capsules. And we also know that there's a feedback cycle back to the spinal cord that reduces the excitability of that stretch reflex that accounts for the spasticity. So just don't have to know all the intricate scientific details about it. The take-home point is, for muscle stiffness, stretching is very important. Stretching should be daily, and stretching should be for as long as you can possibly tolerate it. This is kind of a fun slide. The British Medical Journal, every Christmas edition, publishes kind of fun articles. They're not serious articles in any way, shape, or form. This is my favorite that has ever been published. It was a parachute use to prevent death and major trauma related to gravitational challenge, systematic review of randomized controlled trials. Well, there are no randomized controlled trials of parachutes, but do you think people don't use them? So no evidence doesn't mean that things aren't reasonable, okay? That's the take-home point there. There's some evidence that's been gathered to implicate stationary cycling and treadmill use and strength training and spasticity reduction in persons with spinal cord and stroke, so you could extrapolate it to MS. And we know that transient but clinically significant reductions in spasticity have been demonstrated in persons with MS after acute leg cycling. So not only is the daily stretching important, but the aerobic exercise I talked about before has a wonderful impact on managing spasticity without drugs. Maybe in the interest of time, I'll finish up with the slides because we're almost done, and then I can stay and answer questions. Does that sound fair? Okay. So there's evidence to treat spasticity with focal management like Botox or botulinum toxin, and that can enhance the response to stretching. And there is limited evidence in the literature that the longer the stretch, the better the results. Okay, so there is a little bit of something out there in the literature to back up what I'm saying. But again, I have, my clinical experience to back it up as well. And it's definitely accepted as truth in physiatry or physical medicine and rehabilitation. So here are the take-home points. I'm going to go through the take-home points and then I'll be happy to answer remaining questions. There's certainly enough evidence to demonstrate that persons with mild to moderate MS respond to exercise regardless of disease type, so whether that be relapsing, remitting, secondary progressive, or primary progressive, and that exercise may improve MS fatigue, mobility, and health-related quality of life, also known as well-being. And the guidelines now exist, and you know about them, and cautious extrapolation to those outside this age range is encouraged. And persons with severe disability need more individualized approaches, but the same principles of exercise apply. Inactivity, immobility, and especially bed rest should be highly discouraged for MS patients, and actually almost all patients, especially persons who are already at advanced stages of EDSS, because the reserve is a lot less. And deconditioning, so becoming unfit, likely plays a role in the pathophysiology of the disease progress beyond EDSS of 4, and exercise could partly be the antidote. Physical activity and exercise are integral components of the management of persons with MS. And now I'd be most happy to take the remaining questions.
Thank you, Dr. Bruno. So I'm going to start on this far side. As I work my way over, there was a question, are you taking new patients? If so, what is the waiting list at this point, given your current situation?
I still take new patients, and I'm going to be off from the time I deliver, and I'm hoping to work until I deliver. I'm due beginning of June, and I return January 2nd of 2015. So for the referrals that are coming in now, and my referral base pretty much knows my circumstances. They know that they're going to be booked well into 2015. Right now, the waiting period is about 12 to 15 months. I'm trying to get people interested in what I do. I'm trying to hire on fellows so that we can build capacity in the clinic. And fingers crossed, I will have that added capacity when I get back in January. But it's a work in progress. And people in this room who have already met with me know that each initial visit is often a 2-hour proposition. So it's a challenge for one person alone to go through all that. But yes, I still take on new patients.
Thank you. I'm here.
In one of your slides a while back, something balance training was on the list on the slide. What exactly do you mean by balance training?
So that varies person to person, but there are things that people can do to reinforce being able to tolerate standing with their eyes closed, for example, standing on one limb. In a nutshell, it's with some supervision and some guidance on how to manage your core, how to activate some of the muscles in the core and some of the muscles in the leg, to kind of go through that and then practice. First practice supervised and then practice unsupervised. So yoga is an excellent way of getting some balance training out in the community without having to have guidance from a physiotherapist. But a physiotherapist would be an excellent resource to actually go through in depth what specifically for you would be the best way to improve balance.
Okay, over here.
Hi, I thought I might take the opportunity to respond a little bit further than what Dr. Bruno has said. I'm a physiotherapist who also has MS. I work at Toronto Rehab on Dr. Bruno's team. And balance also involves being able to shift your weight from one leg to another, all around the base of support, sometimes quickly, sometimes slowly, so that you can respond to perturbations. I'm pushing my husband here, or having to move quickly and so on. And it's a very, very frequently done exercise in physiotherapy. Just like to comment that we do run a tremendous number of programs for people with MS at Toronto Rehab. There are fitness programs. We've got an exercise DVD which addresses aerobics, strength, balance. And we also have a community-based program out at some community centers. It's called Time. There are a couple people in the room who go there. And again, it involves a lot of these types of exercise that absolutely needs to be done. But as a person with MS, I try to exercise and do the kinds of things Dr. Bruno was talking about in my own home. I have an arm-leg cycle, so it incorporates the arm movement and leg movement at the same time. I'm trying to do it holding the microphone. And I cannot emphasize, as Dr. Bruno said, the importance of keeping cool when you do that. In the summer, it's almost impossible to keep going in your exercise. You probably all noticed that, as I have. So we're very fortunate. We have air conditioning. I also must have the fans going, and I yell for dear Ed, and I say, Ed, I'm getting hot and tired. Turn on the fan for me. And he has to come running, because if you don't keep cool, you'll get tired, and you won't be able to go as long, and you won't be able to do your program. So such a critical piece as we all try to exercise at home. So just a few comments.
And I apologize, Joanne. I should have had you up on that stage next time.
It seems that you were speaking about heat that you generate when you exercise. Previous to acquiring MS, I was a long-distance cyclist. So going to the maximum and to generate heat was normal. So that's something that I'm used to. Do you suggest this because the general population may not be able to tolerate this, or is there a medical reason for that?
No, there's a very distinct medical reason. It's called Uhthoff's phenomenon, UHTOFF''S. And there are, the way that nerves talk to each other, the nerve cells talk to one another, is predicated on two things: an electrical signal and a chemical signal. And for that electrical signal to be as efficient as possible, it has to run under certain temperature parameters, especially once the myelin coating is off of that nerve cell. So it has to do with the physiologic response to temperature changes, and the responses to temperature changes are slightly different for problems in the central nervous system, so brain and spinal cord, versus the peripheral system, which are the peripheral nerves, sensory and motor and autonomic in the limbs and in the trunk. So definitely physiological. There's person-to-person variation on how sensitive people are to that phenomenon. Some people are acutely aware of it, and some people are less acutely aware of it. With persons who have a lot of spasticity, they may actually mind the cold even more because the cold temperature reinforces that abnormal reflex arc, so muscles become even stiffer. But to some degree, all persons with MS are heat sensitive. So body temperature, keeping the body temperature a nice regulated state, and environmental temperature. So the ambient room temperature, very important.
Is there any other questions for Dr. Bruno? Yep, we have one right over at the back here.
I have a question. It is about the effect of exercise on tremor. Is there the benefit from having to do the exercise to reducing the tremor?
I say yes, and I'll explain why, but it is unfortunately not as dramatic or as noticeable as for other types of mobility challenges in MS. Why I say yes is that we know in persons with a high burden of what we call cerebellar MS, or the type of MS that causes the tremor and ataxia or incoordination of limb movement, we know that that tends to progress. We know that it tends to progress usually at a relatively aggressive rate. And by exercising and getting that blood flow to the brain, you're doing a couple of things. You're doing as much as you can to stall the rate of progression of those changes, and you're also keeping your body systems up as best you can to compensate for those problems. And finally, because a person with tremor and ataxia is going to have a very high fall risk, by exercising and keeping your muscles nice and strong, you spare yourself some of the harm that comes from slips, falls, and other problems. So yes, okay?
Okay, over here at the back.
Hi, Dr. Bruno.
Hello.
Bruno, what do you suggest when you find your leg becomes spastic and it seizes up? Is there a specific exercise? Like I've heard people say, well, just step on it and just put some pressure on that leg and it'll go away.
Yeah, so I mean, clearly spasticity is multifactorial and it responds to a lot of different things. There's like a traditional pyramid approach to dealing with it, and the base of the pyramid is to remove any noxious stimulus. That could be even as sort of trivial as tight clothing. So sometimes, making sure that you're as comfortable as possible limits it. One of the things that is incredibly profound as a trigger for limb spasms is a disinhibited bladder spasm. And you won't know yourself that you're having a bladder spasm. But if your bladder is not well managed, you're going to be winding up your tone. So managing bladder and managing bowel to the best of your abilities is essential in keeping your spasticity as low as possible. And then once you've done those two main things, then of course doing the sustained stretches. So if your leg tends to go into an extensor spasm where the knee becomes very stiff, you can't bend it, maybe the foot and ankle points down and in, you want to stretch all the muscles that are doing that. So you want to stretch your anterior thigh muscles, your quadriceps. You want to stretch the heel cord muscles, so the gastrocnemius and the soleus. You want to do those stretches a lot. Most people who have quadriceps tone also have hamstring tone. So really, when I counsel people on the stretching for the lower limbs, it's really about stretching all the major muscle groups of the lower limb. And, starting off with whatever you can handle and stretching not to the point of pain, but to the point where you notice that you're actually having the stretch. And then working up to those, minute, minute and a half, 2 minute, and so on stretches. Then, of course, there are a lot of medications and a lot of medical treatments above and beyond taking an oral pill. But you could discuss that with your neurologist or your other MS specialist to get more information on that.
Well, I do believe that this might be the end of the questions, Dr. Bruno. So again, I want to thank on behalf of the MS Society Toronto Chapter, Dr. Bruno, for taking the time today to be here. Thank you.
Thank you. Thank you.
And I also want to thank our funder today, Biogen IDEC, for supporting this event so that we can put on such programs and bring in such fabulous doctors. So that concludes our afternoon. I'm going to put our slide back up on the screen that talks about upcoming Toronto Chapter events. This particular event will be on our website in the next couple of weeks, I trust, along with the slides that Dr. Bruno has shown will be alongside the presentation. So if you wish to watch that again or forward the information to someone else, please do. Thank you.
Thank you. You know what? I should have been smarter, and I should have brought cards.